Good morning. My name is David Staggs. I'm the CTO of Jericho Systems Corporation. I'm here to talk about technology, so I don't have to worry that much about all the politics and the policies that have to be in place. I will say that I agree with Mark that privacy is becoming more and more important. The recent European Parliament paper that came out in January of this year, and the Consumer Data Privacy and Network World that came out from the White House in February, both say that patients should have some meaningful consent. They both stress that patients should be involved in their health care. So what we do at Jericho is we make the authorization pieces that fit in to different systems, as Romulo was talking about. What I would add is that some of the issues when we're talking about data segmentation and patient-centered options is, where's the data? Is the data going to be held in a central database? Is the data going to be held federated? And we have been working this problem for several years, and the traction we've gotten has been focused on, well, what happens if providers keep their patient information and you have a federated system, meaning you make a request, and each time you make that request you get the most recent data, and that's called the edge of one organization. So if you could look at the edge of an organization, perhaps you could make those requests and responses have the attributes that are necessary to allow patients to give consent or for organizations to determine whether that access should be allowed. So we've been working for several years on this. Richard Thornton and other members have been working in standards organizations, and we've developed these attributes back in 2008. Several vendors showed them. So we're working in concert, and we're trying to provide the standards that it will allow people at the edge of their organization to determine whether something should be released or not. We're doing it in a policy-based approach. So no matter what the policy is chosen, we'll be able to provide that. If you do opt-in, opt-out, we can do that. It's all just policy to us. So I think we're looking good as far as the exchange of information on the technical level. It's just an issue as to how we're going to push forward the benefits to our population without risking any harm to our patients. That's a very serious topic. The loss of patients has a profound effect on their families and on their future generations. So we want to give the most benefit as possible with the least amount of additional risk.